My name is Dr. Phil Ferreira-Lay. I am a consultant psychiatrist and psychotherapist working here in Harley Therapy. I have 10 years experience of working as a consultant, and my particular area of interest is ADHD. My work here in Harley Therapy focuses on the assessment and support of older teenagers aged 16 and above, and adults where there may be a question of ADHD needing to be addressed. My particular passion for ADHD stems from a couple of sources. Firstly, it is a subject that I find inherently extremely interesting. ADHD is a common condition that affects a significant proportion of the population. Unfortunately, there are a dearth of services in the UK for adults with ADHD. Therefore, I hope that by being part of the team here in Harley Therapy, we're able to help as many people as possible with that potential diagnosis. The other reason I'm particularly interested is more of a personal one, because my wife and youngest child have ADHD. So I am all too aware of the impact that the condition can have on individuals and what it can mean for the nearest and dearest around them. If you were to come and see me or colleagues here in Harley Therapy, you would most likely have an initial assessment appointment. Initial appointments with me typically are between an hour and an hour and a half. In that appointment, we would be looking at a number of things to help us be clear whether or not ADHD helped explain your difficulties. Unlike other bits of medicine or psychology, we don't have a scanner into which we can put people that will then tell us definitively whether somebody has ADHD or not. Instead, what we have to rely on is gathering information so that together we can best understand the current difficulties, the needs, make a diagnosis if applicable, and then discuss and agree a potential treatment plan. In an assessment meeting, we would spend time considering the current difficulties and exploring the impact of those at home, at work, at school, in social relationships, and in work-based relationships. We would also look at your development, the client's development and how they were able to function as children and as they got older is a key part of having an understanding about this question of ADHD. We would also look at questionnaires and screening tools, some of which would be completed before the appointment as well as within the appointment. This would help us again map out strengths and difficulties. Finally, we would also explore together what you were hoping to achieve by coming for an assessment. It may be that there are particular things that you've heard or read about in the press or through friends when it comes to what support might look like. So a key part of the initial meeting is to explore those too. That meeting is then backed up with a 20-minute follow-up appointment over Zoom, which we can use in a variety of ways. Sometimes it's to complete bits of work that we haven't been able to do together during that initial meeting. Sometimes it's to take first steps in a management plan that we would have considered. And sometimes it's a combination of both things. When it comes to support for ADHD, there are two usual means. One is looking at practical or psychological based supports, and that could entail giving advice and support that might be implemented in the workplace, at home, or in school. It may be that CBT or another psychological therapy is indicated, especially if there is evidence of a coexisting anxiety, depressive or obsessive compulsive disorder component to difficulties. The last element would typically involve a consideration for medication. There is a good evidence base that in the support and treatment of moderate severe ADHD, the use of medication such as stimulant based as well as non-stimulant based medication are good options that may improve functioning to a high degree. Feel free to contact Harley Therapy with any questions you might have, and that I would like to get to meet you and to see if I would be able to help you specifically with your concerns. I hope that you found this introduction helpful, and I look forward to meeting you in due course.